Marilyn Clement. I'm Marilyn Clement. I'm the National Coordinator of Healthcare Now. So we are in a very serious situation. We are listed as number 37 in the world in terms of both quality and the provision of health care for our people. And the statistics around infant mortality are even worse because we have gotten worse. Actually, this is the first time since 1958 that the United States has a worse infant mortality rate than it has had than the year before, and we're now counted as number 42 in the world, with Cyprus and South Korea and Slovenia and all of Europe, a whole lot of countries ahead of us in terms of infant mortality. So we said, what can we do about this? How can we build to have a national health care system in this country? People want it, desperately want it. And when you have polls and ask people what do they think, people say the government should guarantee health care to everybody in this country. And that's what they want. It's about 73% in the polls, the most recent polls, that 73% of the people say that's what we want as a health care system. So we said, how do we build that? So we said, let's put together faith groups nationwide. Let's put together labor unions and nurses and doctors and the groups that are already out there saying we need a national health care system. Let's put those all together and provide a base, a concrete base for the kind of campaign that we need. And then at some point in one of our national strategy meetings, someone said, what if we had a citizen congressional hearing and we called our congressperson home to listen to what we have to say about the healthcare crisis and testify? We have testimony just like they have in Congress, but we do it ourselves and we control that, and we're the ones who decide who's going to speak in those hearings. And so we put the word out on our national listserv, which is it's almost 15,000 people now, and we said, would you like to organize such a hearing in your city? And over 100 cities have now said, yes, we want to do a citizen congressional hearing, and more than 50 of those have already happened. And as a result of those, what's happened is that we now have 73 members of Congress signed on as endorsers of H.R. 676, which is a single-payer national health care system using a model such as Medicare for All, an enhanced and improved Medicare for All, and I'll explain that in a minute. But we have 73 members of Congress now signed on at a time when, so far, the people who are in control of Congress have not allowed there to be any hearings, any discussion of this issue on the floor of the Congress. So one of the things we're now saying, and I'm jumping a little bit to where we're going right now, but we believe that we need to concentrate on electing what we're calling healthy candidates. And that means candidates who will commit right up front to supporting a national single-payer Medicare-type system for all, and also commit to not take money from the insurance companies and the pharmaceutical drug companies for their campaigns. So we're looking for those candidates all over the country, and there are a lot of them already who've committed, 30 or 40 of them who are running for Congress. And we're saying, okay, these are the people that we want to see elected, and some of them are Republicans, and some of them are Democrats, and some of them are independents and Greens. But we're saying all of them should be seen as the kind of people that we need in the Congress. And we're a single issue organization. We just feel like somebody has to stand there and say we need a national health care system. So that's what we're doing. We were very lucky to have Leo Gerard, the president of the Steelworkers, and Jim Winkler, who's the head of the United Methodist Board of Church and Society, and Leo and Quentin Young, who is one of the founders and creators of Physicians for a National Health Program, to come on to be our national co-chairs, the three of them. And so that sort of underscored what we were talking about in terms of bringing those forces together. Then we've been very, very fortunate to have someone in our midst who was running the Kentucky campaign to say, let's get the labor unions on board. And she's been talking with and sending resolutions to labor unions nationwide. And 154, we have 154 endorsements of H.R. 676, the National Single Payer Bill, from major labor unions, including most recently the United Auto Workers in their convention 2 weeks ago, the International Longshoremen's Union, the Steel Workers, of course, and a number of other unions. The American Federation of State, County, and Municipal Employees in New York have come on, and it's the biggest, it may be the biggest single local union in the country. It's 125,000 members in New York City who have come on board. But all over the country now, millions of workers have endorsed a national single-payer system. So we feel like we've made a huge amount of progress in 3 years, and we feel like another 3 years, we're really projecting that we could have in place a national single-payer healthcare system that would provide a wonderful system for everybody within the next 3 years. Say, have a vote on it in 2009, begin to really implement it in 2010, if we all work together. So that's what we're up to. Now, let me tell you a little bit about what the bill looks like. H.R. 676 would provide for everything that we need, basically, in terms of health care, for every single person, no matter what race, what status, what type of work, whatever age, everybody would have all of the things that they need, including dental and optical care, mental health care, prescription drugs, doctors and nurses, and hospitals and specialists, and long-term care, and there are other pieces of that, but it's that kind of comprehensive health care. Choosing our own doctors, choosing our own health care facilities, everybody having a single card that is their national health insurance card that they just take and give that to the receptionist at the doctor's office or the hospital, and that is the payment for health care. We would no longer have co-pays and deductibles and denials from insurance companies. It would be a system that is seamless. And that's actually the language that is used by the World Health Organization and the World Trade Organization, which points to systems like Finland and New Zealand, and they say these are the best places in the world for businesses to do work, to take their businesses to those countries because they have a seamless healthcare system. It's one of the factors that they point to. That's the way it would work. We hope that everybody who's listening to this, wherever you might be, will respond by going to the phone and calling us at 212-475-8350 to find out what you can do to make this come to pass, what kind of resources you can get, what kind of help you can get, who's working on it in your area, who you can connect with, and also going to our website, which is www.healthcare-now.org, and looking at the resources and looking at how it would work, and looking at the news pieces that are from literally all over the country and all over the world, looking at a place, the tool list, so that you can actually go click on a button and send a letter to your member of Congress, or click on another button and send a letter to the media in your particular area, or sign our petition right on the website, or download the petition and other materials that you can carry around with you and help people understand the issue. We can also provide speakers for your community, and if you want to join Healthcare Now, you can join, and we will send you a free DVD, a 10-minute little animated DVD that talks about what single payer, how it would work. So those are some of the resources that are available, and we would just love to hear from you.